So welcome everyone to our second year of hosting the Health Needs Navigation Campaign. So today we're going to be having the kickoff call. We're going to describe a little bit more in detail about what exactly this campaign is and some of the direct actions we would like you all to take in your community. So to start with some housekeeping, we ask that everyone mutes their lines. We do have a fairly small group, but just to make sure that there's no feedback, if everyone could mute their lines. And if you have any questions, please feel free, because we are a fairly small group today, to unmute yourselves and ask, or go ahead and drop any questions or comments that you may have in the chat. And as always, we are very open to any feedback that you have. So if there's something that doesn't quite make sense, or something that you would like us to elaborate on as we go through some of the different resources available to you all for this campaign, please feel free to share that. And no pressure, but we would love to see your faces. So if you are willing and able, we would love for you all to turn on your cameras, but of course, there is a lot of Zoom fatigue, so no pressure at all. For this campaign, we would like to thank two of our sponsors having made Needs Navigation possible, Johnson & Johnson and Pfizer. So to start, we would love to have some brief introductions for people to just drop in the chat their name, where they're calling in from, and if you have participated in the campaign before. I can briefly start. So I'm Mary McKira. I'm the manager of grassroots advocacy at NPAF, and I am located in DC. And as mentioned earlier, this is our second year doing needs navigation. And we have Melissa on the call as well. I will have her introduce herself, and then we can move on to the agenda.
Hi, everyone. Melissa here, and I am calling from Virginia. And yeah, super excited to have new faces and some old ones here. We're really excited to get started.
Oh, we have a West Coaster here. Welcome.
Awesome.
Wonderful to have you. Perfect. So for the agenda for today, we have, we're going to give you a bit of a background of what Health Needs Navigation is, sort of the differences between what the initiative is as a whole to the organization, and of course, how we employ that during campaign season, and of course, the overall goal of Health Needs Navigation. We also want to share with you all the toolkit we have for you, and it'll help you navigate how you're going to be organizing in your local communities, and different things that are newer from last year. We're going to discuss if you all have any questions, anything you would like to add, and of course go to next steps regarding the campaign, or any questions you may have. So I will go ahead and pass it over to Melissa to get us started on the background for the campaign.
Thank you, Mary. All right. So I would love if any of you can just drop into the chat. I think some of you may have already added in if this is a new campaign to you, but I want to know also if this is just completely new, like if this is like the first campaign you've ever participated in, whether it's one of our campaigns or whether, just any sort of campaign, whether it's political, another nonprofit. Seeing some completely new first campaign. Awesome. Thanks, Francis and Jessica. All right, I just wanted to check to get a sense of just where people are. And I'm really excited to see that. What some of you may already know, in my role here at NPAF, I work very closely with Mary here in building our grassroots advocacy program, and we are building initiatives or campaigns that we really would love for you all to take to your community. And it's been our goal for this organization to build a patient-led grassroots movement that can transform healthcare. And for some of the other campaigns that we work on, that is, be a hero, make a plan, caregivers count, get covered, in addition to health needs navigation, all of these campaigns are focused on issues that directly help patients and caregivers. And we really think that these campaigns can help position you all as trusted peers and leaders in your community. And so we're going to specifically talk about health needs navigation today. And as Mary mentioned, two things that we really want to make sure that's distinct and that you all can understand, because you probably have heard, if you've tuned into some of our other webinars or have read our newsletters, you may have heard us reference needs navigation before and might be a little confused on what is needs navigation? I've never heard of it. What do you all mean by it? What is health needs navigation? How do they differ? So needs navigation really refers to the services that that are provided to address the most pressing needs that patients and caregivers have, whether that's financial needs, social needs, anything related to accessing healthcare and maintaining quality of life. And we've made it our ultimate goal in this organization to make needs navigation services as a part of mainstream healthcare. And this initiative is going to be one that we're going to be working on for many years. We know change does not always happen very quickly, but we're trying to be as patient as possible. But we also know that we have an immense resource in our grassroots network, and that's why we have this health needs navigation campaign, because we think by deploying you all as our volunteers, as our advocates, you all can help move the needle to bring us closer to making sure that needs navigation services is a part of mainstream healthcare. And what we are doing this year, as this is the second year of our campaign, as Mary mentioned, we have a very specific ask, and that we would love for you all to help us collectively find 20 community organizations sign our petition. And so before we dive into just sort of how we're going about the actions of this, community campaign this year, we're just going to talk a little bit about needs navigation for those who are just learning about it for the first time. So we have this infographic here that we think is really helpful in making sure people can understand why needs navigation is a lifeline for patients and families. And so a lot of people who first interact with the healthcare system, go into a clinical setting, whether that be the hospital or a doctor's office, receive a diagnosis, whether that's a serious illness diagnosis or maybe it's a serious illness diagnosis for a loved one. And, you're immediately hit with, okay, what's the treatment protocol? How much is this going to cost? What are the symptoms and side effects of the treatments? What are my clinical goals? It's all very, very medical and clinical, right? And then when you take all that knowledge and you get out of that healthcare setting and get back into the home, and suddenly you're confronted with some of these other things, right? How will I make it work? How, if you're paying hundreds, thousands of dollars for treatments for your insurance, how can you afford housing? Can you stay employed? Can you actually transport yourself to get to your appointments, or do you have to rely on a loved one to take time off work to make it to your appointments? If you're, having trouble paying for your medical bills, you may also be having trouble paying for other things. And what is it that who can patients turn to, right, when this is happening? Sometimes they'll, lean on a caregiver, and a caregiver will help navigate all of this. But sometimes that luxury that isn't always available to patients. And so here enters needs navigation. And we think these services are really key for making sure people can just manage their life better, manage their health better. And oftentimes it needs a person, another person to take you through the healthcare system. And really, that's our focus here with needs navigation. We know that there are many different navigators or advocates that are out there, whether they are board certified patient advocates, community health workers, social workers, nurse navigators, even the case managers at Patient Advocate Foundation. There are so many wonderful healthcare workers who are providing this type of service, but not many people really know about it. And we think that's the problem. And that's why our main initiatives is to make this a part of mainstream healthcare. And we think we have a real window of opportunity right now to make this a part of our healthcare system. Between COVID, rising healthcare costs, a number of just disparities and equities that are, or inequities in healthcare that are really coming up to the forefront. There's a national dialogue that's happening, and we really think we're well positioned to direct the narrative of what comes next. And we've really been thinking about this needs navigation initiative for the past couple of years. It was actually something that we had conceptualized pre-COVID, and I think COVID just really magnified the issues that patients and caregivers are facing. And we were just like, you know what, we really have to get to work. We really need to make sure that it's not only a lucky few who know about needs navigation services. And so we've deployed this timeline in this plan to figure out how we can socialize needs navigation. And what we mean by that is raise awareness about these services. We want to eventually, make needs navigation a standard of care, so that we have a field of practitioners who have agreed upon practice guidelines, and people know the effectiveness of needs navigation. And we think all of this is necessary to eventually scale this so everyone has access to it. So we are here. We're really at the beginning, just starting with that socialization. And that's honestly where our advocates, people like you, really come into play. But you see, with standardizing and scaling, standardizing can help influence practice, and scaling will require policy change. And so a lot of the grassroots initiatives and activities that we have outlined as part of this campaign are really helpful for all of these actions to take place. So between our plan to really embed needs navigation as a part of healthcare, as well as another sort of parallel track that we're working on to bring Patient Advocate Foundation services to targeted regions within our country who have the highest need. We think this parallel approach can be so pivotal to the role you all do as our advocates in making sure that people understand the importance of needs navigation. And so I'm going to turn it over back to Mary Makira, who is going to share a little bit more about just the organizing opportunities and some of the actions we have outlined as part of our campaign this year.
Thanks, Melissa. Yes, Melissa, thank you so much for that overview. It's interesting because when we organize in our communities, when we are attempting to, make incremental institutional changes, there's so many people get excited about the cause, and there's a desire to have more than one or two or three actions to take. And this is something that people, this particular campaign is something that many people are very interested in. And, we want to be very transparent and share that, as Melissa shared, we're still very much in the socialization part of this process. And what that means is we want you all to help us build demand. On the grassroots side, from the grassroots perspective, once people understand what this is, and people are able to get on board about this, it then, in our minds, in your community, people start to recognize and connect certain dots between, okay, you know what, this is something that absolutely should exist. I shouldn't have to struggle to find information that's related to my health. That's you hear one thing, when you're at the doctor's office, and you hear another when you're on the phone with insurance, and you hear another when you're, in front of, in front of a separate clinician, or whatever that may look like. And so we want to really make sure that this is done well, and it's done right. And as much as we would love for needs navigation to be embedded within our healthcare system yesterday, this is something that we want to make sure that we are intentional with every step that we take forward. And so that being said, with our approach to advocacy here, as Melissa mentioned earlier, again, we're building a patient-informed and patient-led movement. And so what that means is, National Patient Advocate Foundation would not exist without you. And we want to make sure that every campaign that we forward and every initiative that we have, it is informed by individuals who have the most consistent experiences within the healthcare system. And that being said, with needs navigation, as with many of our other campaigns, but specific to this, we want to make sure that you all are positioned as leaders in your community when it comes to how you all are receiving care and what the resources may or may not look like in your immediate communities. And what our primary goal here within this grassroots campaign is to get 20 community organizations collectively, not individually, but collectively have 20 community organizations and individuals, however that may look like for you, to commit as an ally to advance needs navigation. And so what that looks like when when you are educated on the issue, and you've asked us as many questions as you can, and you've reviewed some of the materials, definitely are asking you all to help educate your community on what needs navigation is and how these services can help patients and families really minimize any disparities that they may face when they're going in for care. And so one of the questions, I think, to really sort of ease how you're able to navigate those conversations would be, asking people in your community, wouldn't it be great if there was a 411 to help navigate for your care? If you could just pick up the phone easily, have easy communication. Hi, I received this bill, or I don't know what my options are, my plans are. Everything just happened so quickly in the doctor's office. I wasn't able to sort of connect, what the physician was telling me to what my next steps were. And, there just being a place where you're able to navigate your health, of course, long-term on the national level, but there's so much more that could also be done locally, and pull local resources together and have local governments communicate what resources exist and what you all could build together, dependent on what the need and demand is in your immediate community. So that's one of the primary tactics that we're asking you all to employ, is, of course, educating people, understanding what your community needs are, and executing in that way. And of course, this takes time. This is not something that we expect to be done in a week, but we're just sort of overall high level. This is what it will look like. Next is, of course, to identify which local organizations you may believe would want to help or support this initiative, or groups that have enough sway that they're able to get those key health groups to sign on and support what needs navigation could become in your community. And that's going to look different in every locale. So there are counties and cities and states that may have, some health initiatives, some smaller health initiatives, and that may be beneficial for you all to reach out to. Maybe some communities, it's not necessarily, they may not have, direct outreach, health outreach organizations there, but they'll have, education groups that exist that also have health as one of the things that they like to build upon in that community. Or maybe there's some local patient groups or student groups that also sort of dabble in improving healthcare locally. And so just sort of figuring out what the landscape may look like for you. And of course, continuing to build relationships in your community that way. And making sure that the relationships that you are building are honest and consistent. I think, there are many groups that may feel as if people are always, coming to them and bombarding them with, oh, we want this, we need that, can you help us with this? And they're just gonna have to sort of sift through the noise and figure out what makes the most sense. And so just being super honest about, what the goals are here, what you have observed in your community as far as what the needs are. And I think one of the easiest examples to draw from that everyone can relate to is COVID. There was so much confusion, even in communities that had all of the resources about, okay, what can and can I not do? What are the most up-to-date, reliable resources? How are we able to synthesize that, or how can we make this accessible and available to everyone, regardless of where if they live in a more rural area or urban area, and just sort of communicating that and being consistent with your communications, speaking with them, when there's something to update your people on, or if there's something immediately that you may be working on within this campaign that you want them to get on board with. And so again, to reiterate some of the three main points that you can do with this campaign is learn the stated issue, of course, educate and recruit supporters on this issue, and of course, personalize the campaign to your community and its needs. And so different things that we may spell out, if there are 8 things that we're asking you all to look for, but only 3 are relevant, take the 3 and move forward with that. You all are the experts of where you live, and you would know best on how to communicate this message and what makes the most sense to that end with bringing this campaign to your community. And so one of the best ways that you're going to be able to do this is, again, going and reviewing our resources as you're educating and recruiting people. I wouldn't use too many terms. Some of our volunteers, instead of course, it's called health needs navigation or needs navigation. That's how we certainly refer to it as. And you're welcome to use that terminology, but I wouldn't start off the conversation that way. I would ask the question, wouldn't it be great, if there were a 411 to help patients and caregivers navigate their navigate health resources? Or wouldn't it be great if there was a health resource navigator? Or if in your community, that's not something that may exist, but there are community health workers or people are familiar with, I usually just communicate with, my doctor typically points me to people or resources that could help me better or best navigate X, Y, and Z. So whatever that may look like for you in your community, or if there's a local health clinic that people typically go to, change the language to better communicate with the people that are directly in front of you. And if you're speaking to local leaders, the language is, of course, may be a little bit different than if you were to speak with college students or people at your local clinic. So just make sure that you're changing and updating the language depending on your audience. So we'll stop there. I know we kind of spoke a lot, and see if you all have any questions or if there are any points that you would like us to elaborate on a little bit.
I was going to put this in the chat, but I just wanted to add a point. This is a really good time for folks to speak to their local officials, elected leaders, because everybody's campaigning right now prior to the election that's going to take place in November. And so it's a really good time to express your needs as a constituent to your representatives, your senators, your local commissioners, and kind of craft the message of, look, this is a number one priority for me. This is a deal breaker, and I think that this should be like top 5 priority on your list when you go into office. And this is something that would make or break my vote for you.
Excellent point, Brittany. And I see other hands here. Francis, go ahead.
Hi, Melissa and everyone. I have a question myself. Is there a dividing line between helping people understand the difference between needs navigation and what's quote unquote covered with insurance, or identifying what needs, the gap in the two?
I want to make sure I understand your question, Francis. Do you mind repeating that one more time?
What I'm asking is about if we're representing having needs navigation and people are really relating to their insurance. So in other words, what's the difference between that I have coverage for my insurance and what needs navigation is?
Got it. I think so you're asking whether or not needs navigation is different from what insurance coverage would be. Is that right?
Right. I think people would be thinking about that when we're trying to engage them about their needs navigation. A lot of it would be turned to insurance. I think
that's a really good point, Francis. And I will answer that, but I wanted to make sure I gave Jessica a chance to ask her question too.
Okay, thank you.
Sure.
I have a 2-part question, and I also think with Francis, I agree that there's some health insurance literacy that's really intriguing to people. So, but my question is, I have a 2-part question. So, in my, I would just be interested to hear the people who have been doing this, how they started. I am living in Virginia Beach. I'm technically from here, but I didn't live here for years. I moved back a few years ago. I worked blue collar jobs for a long time. I'm at a job now that's work from home. So I'm not very well connected. I don't know people in my town anymore. I'm not somebody that people are going to want to talk to about this. And I understand I don't need any nice things, but it is a fact. And I kind of need that to be, bluntly realized. I noticed 2 terms that you guys use caught my eye. One was building demands, and the other one was leadership in your community. So I was just, the building demand to me was also the second part of the question, that I had about when I think of building demand, I think of somebody, and this is just from a sales perspective, you build demand because somebody wants something. So if I'm telling people, hey, are you going to be an ally to this, but I can't tell you exactly what it is exactly, other than I was just sort of curious what building demand looks like, and then for someone in a less connected position.
No, that's a really great question, Jessica. I really appreciate you bringing that up. And I'm going to share screen and share our toolkit with you. but I don't want to get distracted by that because I do want to answer your question, Jessica. The actions that we have outlined in our toolkit are for people who are very new to this, maybe don't feel comfortable going out, to those who are more seasoned and feel comfortable going out or talking to legislators or things like that. So you can kind of pick and choose whatever, choose your own adventure, if you will, for how you want to make this yours, whether it's, just maybe emailing a couple of your friends and say like, hey, I want to learn more, or I'm just started volunteering with this organization. I want to learn more about what your experiences with healthcare have been like. What were some things that could have made it easier? There's this group, National Patient Advocate Foundation, that's really trying to embed needs navigation as part of healthcare. And what they really mean by that is, they want to make sure that all patients have access to a person to take them through the healthcare system should they get confused or get lost or get frustrated with the process. And I feel like that could be a very comfortable place to start. And our toolkit does outline, a conversation guide to kind of support you with these kinds of conversations you might be having with strangers or loved ones, as well as, if you, just want like a little template email to, send over to like a healthcare system. I heard you were in Virginia Beach. So like, hey, Santara, have you ever thought of like including needs navigation? Like those are very, I guess, at least for me, I used to be a volunteer, so I completely know where you're coming from. Kind of less threatening, less overwhelming ways to get involved. So I hope that answers your question.
I would add to what Melissa's saying. Learning is also such an important part of advocacy. So if you want to spend this time also figuring out, okay, what are some, I mean, honestly, people even who've lived in their communities for 10 plus years, they don't even know where anything is. To be quite honest, the community that I grew up in, until I got involved in politics, I had no idea, any of that stuff. And then, I didn't know where to find stuff. And that's actually, I think that's actually a pretty strong point to come from, because then you're going to have the types of questions that everyone else would be asking. And so trying to figure out, okay, is there, a local or a health hub? Is there a local clinic? Is there some type of health something? Is there an urgent care that is near me? Is there, what does my local HHS department look like? My Health and Human Services department look like? And then just calling them and asking them, I think especially particularly for clinics and urgent care, people who directly deal with patients, and asking them, hey, do patients ever ask you for help navigating resources to help with copays or medications, or trying to figure out any resources sort of even outside of medical? Do they ask, is there anything that could help me if I'm going to pay for my medications this month, something that could help me with my utility bills? Just sort of questions that patients would typically have, or things that they would be nervous about. And then you could just sort of learn and hear from their perspective of, well, this is what people typically say or ask. These are trigger words for them. I think especially the HHS department, just sort of figuring out if they have, a website, I'd look at that first. And usually they're not user friendly, those government websites. But I think just even topically looking through and then calling them and seeing if they offer, or if they have any local programs, whether it's, food drives, or, whatever types of resources that sort of connect to the overall patient experience, and seeing, are there questions that people ask, or is there something, that was more in demand the past few years than previously? Why do you think that is? and just, getting a lay of the land and just trying to figure out what is it that people in the community need? How did they know to go to you? Has traffic on your website gone up? Is it kind of the same? And are people just learning through word of mouth? What does word of mouth look like? Are they finding you guys from, church groups or, PTA meetings? Just trying to figure out where do people meet and how are they connecting, or Facebook groups. And that is so valid, because once you figure out where everyone is getting their information and the types of questions they're asking, that is how you're going to better be able to identify what the needs may be. And it could be one or two. Maybe they're fine with their health stuff, but they need more help on the social end of, they need food, they need help getting to their doctor's appointments, transportation wise, or, whatever that may be, and just sort of taking note of that. And then trying to build a consistent relationship with those entities, to just sort of feed you sort of that knowledge and information, and just trying to figure out what could this look like in my immediate community, and how can we make it better or more accessible. Hopefully that helps.
It was super helpful. Thank you so much. Yeah, thank you.
Perfect, of course. And Francis, we did not forget about you. But
Yeah, Francis, I will definitely answer your question. I want to have a good segue there. Kate, please go ahead.
Hi, thanks for having this. I also have kind of a two-part question, but the first part, it kind of follows off of what your answer to Jessica's question about, like, how sometimes the needs are more social than medical, such as transportation. So can the organizations that we get to sign, can they be a social work focused organization, like such as like a women's resource center or something like that?
Absolutely. Yes, absolutely.
Okay, great. And then my other question was, is the goal for each of us to get 20 organizations to sign?
It's
20.
for all of our volunteers. So if you guys contribute one, like if everybody here contributes one, then we're at 12. That would be awesome. If you guys get more than one, also, awesome. But I think the idea is collectively we're starting small and we're being realistic, because we know this is very difficult to talk about, right? Like it's the words and the nomenclature don't come easily. And so I'd be also curious to hear from you all as you're talking about this, like, how are people describing their needs? Would they ever say needs navigation? And again, this is just a term that we at National Patient Advocate Foundation have coined. We really want to do more research and studies to see if this is, if people are going to be demanding this, are they going to say we want needs navigation, or are they going to say we want patient advocacy, or we want a patient advocate, right? So we're learning as we go, and I know it may seem a little messy right now because we are starting out, but we really think all of the information, your experiences that you all have as you're talking to people can be really helpful in making this initiative just go the right course. We really want to be thoughtful, and we're not trying to, by no means, we do not have all of the answers, but we really feel like relying from our volunteers and our advocates and hearing what you all are hearing in your communities is incredibly, incredibly important. So we want to really take that and learn from it and improve this campaign, improve how we, when we eventually get to the point of introducing legislation, whether it's local, state, or national, that we're actually using words that patients and caregivers would use, because again, we really want this to be a patient-informed and patient-led issue. I hope that answered your question, Kate.
Yes, thank you.
And Tony and Brittany, I will get to you in just a sec. I do want to answer Francis's question. And I also want to screen share and show you all our toolkit so you guys can have some sense of exactly what activities we have planned. Francis, so your question about needs navigation and insurance coverage is actually a really good one, and it's not one that I've actually encountered. We see needs navigation issues or as pretty separate from insurance coverage. This is a lot of the times, in many ways, I feel like insurance kind of contributes to the issues where a patient may end up needing a navigator or patient advocate to kind of take them through the system. Because a lot of the time, the experiences that patients or caregivers might experience are having a particular treatment denied by their insurance. And oftentimes caregivers, they don't know what to do once it's denied. Like, can they appeal? How do they appeal it? Who can take them through that process? And that's where we feel like a navigator or an advocate can really help that process for an individual. And to your point, though, Francis, there are some insurance companies and some payers who are providing financial support or not necessarily financial support, but financial or social support to their beneficiaries or to the patients. And it's a newer sort of initiative, and some of them may kind of put it in that bubble of social determinants of health, and this is how they are helping their beneficiaries get the most out of their plan. Some of them provide transportation support or cover those services. But again, a lot of the times patients don't even know that that's a benefit for them. And so it really is helpful when you have someone who is trained, whether it's a board certified patient advocate, a case manager at Patient Advocate Foundation, community health worker, who have a better, just better knowledge of what this space looks like, to really take patients through, because patients, it does not come intuitively to them. It doesn't really come intuitively to a lot of people. And that's why we really call for having, a person to take you through that healthcare or through the healthcare system, because it's incredibly confusing. I hope that helped you, Francis. Please let me know if you need me to expand more. And while we're waiting there, I wanted to just share how to get to the toolkit that we are, sorry, I'm having some tech issues here, that we have put together for this campaign. So this is the toolkit, but if you go onto our website, we'll just start from npaf.org. You all can see my screen, right?
Yes.
Okay. Get involved, join a campaign. Under the first campaign, Health Needs Navigation, just hit get started. And here's the toolkit if you hit download. And so it takes you to a Google Doc. I think what you all will see will be a little differently than what you all are seeing here, just because I have sort of the editing powers, but it's a Google Doc, and this is a live document. You may see that we might add some things to it later, might take some things away, but essentially everything you need will be right here. We talk about, what the goal of the campaign is, some background information on what needs navigation is, and just some other resources that you all can review. We talk about the audiences that we really want to reach, patients, caregivers, patient advocates, or navigators, and then kind of break down what resources are available to you here and what are those that you can share with your community. And I meant to do this earlier, but I just wanted to give a big shout out to our campaign committee. I know some some were on the call. I know some couldn't be here, but they really helped build a lot of the tools that are included in this toolkit, the community outreach checklists and the conversation guide among those. And so I just wanted to call that out specifically here. But you'll see here just various actions you can take. Again, we have just actions for people who, just want to maybe share something on social media or just talk to their friends, to people who, somewhere in between where they just, maybe can send an email to an organization. And then others who may want to take it a step further and actually convene a listening session and hear what people in the community are talking about and what are their issues. And so some of we have our week of action taking place this week, starting today. So joining our kickoff call is one of the first actions. Then we have actions like talk with someone share resources, plan a listening session, and then identify one local group who can be an ally for needs navigation and have them sign our petition. Then we have just some background information on like how you can get organized in your community, as well as just some templates and things that you can refer to. So for people who are just starting out and like don't know where to begin as far as like who to reach out to, you can use this checklist, check things off as you go, just to keep it nice and easy for you. I think to the question that Kate had earlier about, groups who work in the, social workspace, absolutely. We would love to have them as an ally. A conversation guide, sort of how to approach this, talking about needs navigation with people, these are new to the campaign toolkit this year. And so on and so forth. We have a sample email template, sample social media posts, and for those who really want to go above and beyond, instructions on how to host your own focus group or listening session, if that is something that feels right for you. And honestly, you can host a listening session with just a group of your friends, and it might not feel so nerve-wracking. But I think that's just, just some ideas for you all to just think through. But yes, so that is our toolkit. And again, you can find it on our website. I also wanted to show our petition, which you can also access through the toolkit. It's also on our Google Drive, but we did put this petition together to, again, you can have it you can use it as talking points, but we think it really is a very easy way for people to understand this issue that we're working on. And we have an email template that you can use, personalize it to however you like. And this is what you can share with, organizations, people that you're talking to about, we really want you to be an ally for patients and caregivers. And really, a question that they may have is, well, what does it mean to be an ally? And you can say here, by becoming an ally, you commit to take local, state, or national action to make sure we all have the resources we need to navigate our healthcare system. And we do have a link that, takes them to a page where they records their information, usually their email address, and where they're from. And this is helpful information for us to collect. So when we are interacting with policymakers, we can show them like this many people in Virginia Beach felt very strongly about this issue. What are you doing to make this, to make sure your constituents feel at ease about their healthcare? So I just wanted to share that. And I think, Tony K, I know you had your hand up, and I'm sorry, I know some others had their hands up too.
I just was gonna kind of give some ideas, but I think
Yeah,
if the
please.
list is good. You know, when someone asked about insurance, what's really interesting now that you see a lot of commercials out for Medicare Advantage programs, they're promoting a lot of this type of stuff where it's like, if you enroll with us, we will provide meals, we will provide transportation, we will provide, you know, and so insurance companies for Medicare Advantage, they must see that it's very appealing to have this extra type of assistance. You know, I don't know what kind of commercials you're seeing in your community, but it really is promoting some of this. I know in my area, we've got a community resource directory that it's a small, like 3x5 size print copy that everybody in the community knows. Look for that green book. And it's published by our housing area in our county. And when you've got things that you can add, you just call them up and say, hey, can you add this? You know, if you have like a free clinic that people that are uninsured or, you know, can get their care, that might be a place. And I've worked closely with like immigrants and refugees because there's a lot of community health workers that are already helping people newer to your community navigate through a lot of these things. And then one other thing that might be helpful is, you know, AARP, they've got people that are on the ground, you know, doing grassroots advocacy. And that has been a great group to connect with. And if you would get a hold of whoever the person is in your community, you know that they're probably already having gatherings of pulling 20 or more people together to talk about issues. So that might open some doors for people. Just know that AARP is very involved in advocacy. So just some ideas.
Thank you, Tony. Those are great ideas. I would also suggest local area agencies on aging are another great just organization to connect with. But yeah, I think there's just it feels overwhelming. I know sometimes when we're doing this work, it feels like we're, you know, on this long hike and the summit's all the way up there. And we have a long way to go. But I do think there is power in activating communities to help move the needle to where we want it to be. So I think, Tony, sort of the examples you shared are really great ones. That community resource book is such an awesome idea that anyone here could, you know, even suggest that as something that, you know, their communities can do. So I really love that. So I know we have just a couple minutes left. And I think we've done a lot of the discussion. So just really want to, I guess, reiterate just what our goal here is for the campaign. We will send follow-up emails just so you have the toolkit, the resources, some tips on, you know, what organizations to reach. And then of course, know that this is bi-directional. We don't only want to just hear about what actions you're doing, but if you have any questions of us that you're encountering with the people you're connecting with in your community, if people are like, okay, well, you know, obviously this is an issue for, you know, the people here, we want to fix this now. What is something we can do that fixes it, that doesn't require national legislation? Let us know if, you know, if something like that comes up. We really want to hear, because that is, you know, something that we think could be really helpful for, you know, just other volunteers, other advocates, and just really seeing a heat map of sorts of, you know, people around the country are really, really, really frustrated with their healthcare. They need help either making sure that they can afford it. They need help making sure that they can access it. They need help to other, you know, other programs to make sure that they can continue to have food on the table and gas in their car. So, you know, we need to know about these things. The more information we can collect, the better. But if you all have any questions of us, just know that Mary and I are available to you to help either troubleshoot or brainstorm projects. Just let us know. Mary, is there anything else that I may have missed?
I don't believe so. I think this campaign, as Melissa mentioned, it seems very large, and it is, but because we are very, very much in the socialization period of this campaign and of this initiative, the highest ask that we have here is, I think it's twofold. You know, making sure that you all are comfortable with discussing what this is, and having individuals and organizations sign on. That's all you have to do right now. And then, but I will say there are some volunteers that are, you know, incredible and go above and beyond. Some of them are on this call, and they, you know, are just gonna take it and run with it, and then just kind of do their own thing. And you know, they may do they may start their own you know, navigation services within their own local community, and if you are comfortable doing that, and you know, taking it and running with it, when you connect with the right people over time, do it for sure. And you know, of course, we're happy to help wherever we can. But I think those are probably the two main things. Just learn about the issue, and as you're communicating with people and familiarizing them with what this is and what it could mean and what it could be for your community, having them sign on to join this. And they may ask, okay, what's, you know, how often our communication is going to be, and in next year it likely will be quarterly email communications, just updating you all, of course, and anyone that signs on where we are and what future engagement may look like. But yes, I mean, if any of you guys are confused, please let us know, and we are more than happy to run this over again. But yeah, those are two of our highest asks. Just learn about it a bit more, and having people sign on. And Brittany, no worries.
I just wanted to say one last thing. So I did this campaign for the first time last year, and I live in Tallahassee, so, and I've worked in politics before, so I just went straight to my a legislator that I knew. And I think the biggest thing was like gathering information based on his district. And Mary and I had a side conversation outside of the campaign kickoff last year, and she encouraged me to like kind of look up his district, and I did that before, and I was able to go to him and tell him like, hey, this is a really big issue for your constituents, and I don't know if you're paying attention to this, but like your constituents, they vote this as like 80% of your constituents are voting this as like a huge problem for your area. A lot of legislators don't know everything about everything. They're not the smartest people in the room. They need people like us to go over there and tell them what it is. And so if you do your footwork and you do your research and you go in there and you're confident, just know that like we elect them to work for us. And because I understand where you're coming from, Jessica. It's like, oh well, I'm just a person that exists in this district. I don't know these elected officials that like govern the district or the state that I live in, but we elect them. They work for us. So we need to express to them that this is like a huge issue. And yes, government websites make it very difficult because they don't want to spend money. They want to save as much money as possible. But we pay for health insurance. Patients pay for, we pay taxes for certain services, and those services should be provided to us without jumping through hoops to get that information. So I think it's really important that everybody kind of like understands who's running in their area, who's running in their state, who's running for governor. Like, if you don't know that information, I'm happy to drop my email in the chat and I'll help you figure it out, because I think that it's really important to hold these elected officials and bureaucrats accountable. When they get into office, they need to work for us. So, and they need to work for patients and caregivers, and that's why we're here. So that's all I'm going to say. I'm done. Thank you.
I couldn't have ended the call better. Brittany, that was like a total mic drop. if you had it. That was perfect. Thank you so much, Brittany. I think we do have one poll to close out the meeting today. And Mary, if you can launch that.
Yes, I just launched it. Hopefully it pops up on everyone's screens. Okay, we have people answering it. The question, I can read it out loud if some of you all can't see it. What actions will you take for the Health Meets Navigation campaign? All right, we are 6 out of 9. Okay, perfect. I will go ahead and end the poll. And hopefully you all can see what the results are. But the main one was recruit an organization to be an ally. And the one next to it, talk to a family member or friend, and share resources. Can you all see the results on your screen? Okay, perfect.
Wonderful. Well, thank you all so much for your time this evening, or afternoon if you're over on the West Coast or another coast or another part of the country. We really appreciate it. I always say showing up is the hardest part. And so you all being here just makes me really just excited and giddy that there are other people who care about this. So again, know that Mary and I are here if you all need just some coaching or just have any questions. We're really excited to see what you all will do. We'll have a wrap-up call at the end of the month just to check in to see progress. But thank you all again and enjoy the rest of your day.
Thank you all so much.
Thank you. Bye, Brittany. Bye, guys.
Bye.